Hello, welcome to the Gulf Shore Property Owners Association meeting for Thursday, September 16th, 2021. Thank you for joining us today. Our agenda will start with opening comments from Doug Stewart, our Gulf Shore Property Owners Association president. We'll go through a roll call and some other business, followed by the treasurer's report, old business regarding the Gulf Shore Property Owners Association website. If you haven't visited that, I encourage you to go to GSPOA Naples.org. In addition to that, we'll have some updates regarding the Naples Beach Hotel. New business shall consist of Pete DiMaria, Fire Chief from the City of Naples, giving us some updates with regard to COVID. Penny Taylor, Collier County Commissioner, will discuss her dissenting vote on the Army Corps of Engineers Shoreline plan. Craig Mullay will discuss City of Naples permits for member buildings in light of the collapse in Miami of the Surfside building in Miami, the high rise there. We'll have collaborative communications discussions, presentations from Summit Cable and Blue Stream regarding fiber optics options along Gulf Shore Boulevard North. And keep in mind our next meeting, hopefully you'll pencil it on your calendar, December 2nd at 1:30 to review a survey that we'll be conducting shortly regarding member buildings and some other items of interest for our members. Thank you very much for joining us. Doug, please take it away.
Duncan Cameron, who is our government affairs guy. He's the guy that interfaces with the city and shouts and hollers on our behalf. Duncan, are you there?
Yes, President Doug, I am.
Hey, Joe Basili, are you there?
I am here. Thank you.
Joe is my communications guy. Joe puts his wonderful presentations together. So the slideshow we'll be looking at today will be from Joe. He created it. He's my techie, and he answers technical questions that I can't. Terry Copeland, are you there? Terry is not here. Terry will be probably joining us hopefully shortly. Terry is our new board member, and his responsibility initially is going to be to facilitate communications among us. So he and Joe are looking at ways that we can utilize the website for communication. Joe will talk about that later. But Terry is our guy there. Terry, I'm sorry you're not online. And next is our board vice president, Hans Gruenberg, who I know is not online. He had to call because he had an issue that he could not avoid. So he's not joining us today. So we have a quorum. I'm Doug Stewart, and of course I'm here. So we have a quorum and we can carry on the meeting. The first item of business is the last meeting. The last meeting goes back to last year.
Mr. President, I have a motion. I propose that we dispense with the reading of these minutes and approve them as stated.
Do we have a second?
I second that motion.
Okay, all in favor? Board? Aye. Okay, so the motion carries. That we'll hold that off. And what we'll do is we'll post those minutes on the website. The business session, the treasurer's report. Not only is our treasurer on the line, that's Joe, but our bookkeeper, Jane Vasquez, who's been with us for 3 years now, Jane?
I think so.
Yeah.
Something like that.
And Jane has been taking care of all of the money coming in and all the expenses going out. So Joe, take it from here.
Okay, sure. So real quickly, our annual dues, most of you are aware of it, but if you're not, they're $150 a year per condo or co-op. And at this point in time, we've been very frugal. Really, our expenses on an annual basis are minimal. Financial bookkeeping, the website, some administrative costs, postage, chasing people down for dues and that sort of thing. So we're in really good shape. We are going to be spending some money probably coming up, hosting a forum of candidates for city council members and doing some other activities. So the good news is that financially we're in good shape. The bad news is we do have 11 open invoices spread out over 9 properties. The question was asked earlier, how many members do we have? How many condos and co-ops do we have? So our region, if you will, our geographic region consists of from Doctors Pass south of that. And currently there are 39 properties, because one of them is in a state of being a new building's being put up. So there are 39 properties. So on the one hand, we're in good shape financially, but on the other hand, we are limited in terms of the number of prospects that we have to join our Gulf Shore Property Owners Association. So that's where we are financially. Do we have Pete on the line?
Did you look nice? Yeah, tell you it was. Yeah.
Okay. So Pete,
Yes, I'm here.
if you're on the line, why don't we pass it to you? Because I know you're pressed for time and we don't want to keep you any longer than we have to.
And I'm all cleaned up.
Yeah, first, let me thank you all for inviting me today and to have an opportunity to talk to you a little bit. It's
Really?
unfortunate that we're talking about COVID-19 and the hazards that it's causing our community and the state and the country, but I appreciate the opportunity to let you know where we are here locally and some safety precautions that you can all take. I know some of it will sound repetitive, but it's always good to go over that. So I'm very happy to be here. Am I able to share my screen with you?
Hang on a second. I can make you a co-presenter, I think, or maybe.
Or just share screen.
Yeah, share screen.
I think you have to. Okay, so hopefully you guys are seeing the COVID-19 update. And this is something I put out weekly that goes to the President's Council. So I think Doug is seeing it, that all the presidents are getting that. And it's not as detailed as I do on Fridays, but this will give you an idea for your board about where we are as of actually yesterday for Collier. They didn't update when I was doing this early this morning. So in Collier County, there's about 66 per 100,000 new cases on a daily basis. And our positivity rate is about 18.7. And it's concerning that that positivity rate is still so high. I know back through the first couple waves of COVID that we were really concerned when it was 7, 8, 9, and now we're, double that. And it seems like we're, although I know a lot of people are having that responsibility of taking care of your families and each other, it seems like overall that there's a lack of concern right now. The good news is that if we're looking at vaccinations, Collier County is one of the highest in the state at 70%, and that's certainly positive. The other good news on cases, we would see this case come up to about 85 new cases per 100,000 on a daily basis, and now it's dropped down to 66. So that's very positive as well. Something I explained to City Council at a point early on when the Delta variant was out there, that through some podcasts and some reading that I had been doing, that our team over here said it retreats as quickly as it comes on. So in Britain and in some other countries, we saw it come in really strong, infect a lot of people, cause a lot of hardship, but then retreat really quickly. And in my eyes, I think we're starting to see the beginning of that retreat, which could be good news for our community. And quite honestly, when I get to the state, you'll see the difference there too. So hospitalizations, our ICU is 100% capacity. In fact, most hospitals are over their capacity. I have some numbers on NCH later on in the presentation, but you'll see that they've created more ICU beds to take care of the sick people. And so it's important to know that this is causing even people that without COVID, less ICU beds, inability to get those needed medical procedures done, and then get treated in an ICU capacity. So that is something we're always concerned about. And as you can recall at the beginning of the pandemic, we always were concerned about filling up our ICUs. Fortunately, I think our hospitals have a great method of dealing with the overflow. And again, we're seeing a little bit of a retreat. Vaccinations we talked about earlier, 70% fully vaccinated, or excuse me, 70% with one dose. I think we're 60% fully vaccinated. In Florida, the numbers look a little bit better than in Collier right now. New cases are 51 per 100,000, infection rate of 0.83. and the positivity rate of 13.9. And you can see on the line graph that where we were through the Delta variant, and now that we're retreating a little bit. Hospitalization statewide are 89% used, and we're currently at about 12,000 hospitalized patients in the state. And one thing I know we don't like to talk about, but it's important we discuss that deaths are a lagging indicator of COVID-19, and currently the state is seeing 325 deaths per day on an average, on a 7-day average, and that's disappointing. I don't think we're going to see that number go down for a couple of weeks, but if everything proves to be right and that we're starting to retreat, we'll start seeing that number come down in a couple of weeks.
All right. I'm just watching.
Does somebody have a question? Okay, I'll keep moving on. I'm just going to go on into the precautions because I think that was what I was assigned to do more than give you the update. And like I said, a lot of these will be repetitive. Obviously, the number one thing is get vaccinated. If you haven't and you're comfortable with it, I strongly encourage getting vaccinated, especially if you are in one of those high-risk categories. You can certainly beat COVID if you happen to be a breakthrough case, or completely avoid COVID if you're vaccinated. Again, once you're fully vaccinated, you can feel a little more comfortable out in the community. Protect unvaccinated people in our family and in other close circles. Sometimes we need to take steps to protect them. And so if people that aren't fully vaccinated, that can be, we want to encourage them to get vaccinated. People with weakened immune systems, again, we need to encourage them to get vaccinated, or certainly be protecting themselves with some kind of face protection. And with underlying medical conditions the same way, we want to make sure that those people are cared for in our close circles. Wear a mask to protect yourself. I know it's been controversial. I've been beating my drum since April, I think, to put a mask on. It's not comfortable, it's not popular in a lot of places, but it will certainly protect you from COVID-19. I can tell you I've tested hundreds of people here at the fire station. Many of them have been COVID positive. I wear my mask, my N95 mask to test. I do a test. I follow all the safety precautions, wash my hands, be cautious taking off my, doffing my equipment. I've never gotten it. I am fully vaccinated, but I feel like that's, we have people here all the time that are sick, and we're not spreading it because we're wearing our mask and we're using our universal precautions. Also, it's important to point out that if you're outdoors, I think we've learned a little bit more about the virus, that you certainly do not need to wear your mask when you're outdoors walking your dog, or you're outdoors in certain areas. I would encourage you that if you're outdoors where there's a lot of people that you can't separate yourself from, that you throw a mask on part-time or have one in your pocket so you can protect yourself if you end up in a position like that. Also, if you're taking medications that weaken your immune system, or maybe you're not fully vaccinated, throw a mask on when you're outdoors. If you're fully vaccinated, you should have a mask with you anyway, just to protect yourself. We've seen a lot of breakthrough cases. And when you go into the public, if you're going into your grocery store or to pharmacies or wherever you need to go, throw your mask on to protect yourself and protect others. Remember, when you wear your mask over your nose and mouth is important. And right now, the federal government tells us that we have to wear our masks on travel. So planes, buses, trains, other public transportation that we're on definitely need to have a mask on. So get something that's comfortable for you, and make sure that you can keep it on for a little while, especially if you're traveling in a plane. 6 feet away from each other, that's important. It still has proven to be pretty successful in avoiding COVID-19. The droplets that we spread when we're talking, when we're breathing, only can travel so far. Now, there are some studies out there that say some aerosol particles that you can emit when you're talking can stay in the air longer and can travel further. The one thing I can say is that you have to think about viral load in that capacity. So if you're in an area where someone has aerosoled a lot of droplets, you would have to be in close range to those people for a long time. So I still think you're safe if you just maintain 6 feet from people. Make sure that you're keeping that space and not being around people that you might be cautious of being sick. Avoid crowds and poorly ventilated spaces. I noticed this week football started. A lot of football stadiums were jam-packed. It's concerning. It may cause a spike from where we're at now. I'm hopeful that people that are in these stadiums are either vaccinated or using some of the universal precautions to protect themselves and others. I'm sure they're not always, but hopefully this won't be a big spike in the virus right now. So again, if you're in those crowded spaces, make sure that you're protecting yourself with some of the universal precautions. Clean your hands. Back to that, 20 seconds of washing your hands in a regular water and soap, and you can always use a hand sanitizer that's at least 60% alcohol. And remember, after being in public spaces, this is another thing you can think about. I know we see sometimes people with gloves on and things like that. You don't need to do that. You just need to be conscious of when you're out in public or you're in the grocery store or the pharmacy, if you touch things that you're not familiar with, before you touch your face mask or before you put your hands back to your face, make sure you wash your hands. Then you can go on and continue living normal. We can find out how to live with this virus and continue to avoid it and not get sick and protect our family. And some of the things that the presentation has, coughing and sneezing, make sure you protect yourself, by washing your hands after that, before eating, preparing food, touching doorknobs, contacts with other people, handshakes. We may be starting to get back to handshake. Go ahead and shake your friend's hand, and then share a squirt of hand sanitizer. We had firefighter interviews not too long ago. I felt shaking of someone's hand that's trying to get a job as a firefighter was appropriate. I walked out, I introduced myself, I shook their hand, I greeted them, and then I politely washed my hand and gave them some hand sanitizer, just so we can be safe and not take undue risks. Of course, if you're caring for someone sick, you want to always make sure you're washing your hands, touching pets, and always be cautious of handling your face covering. Again, this kind of goes hand in hand with washing your hands. Is avoid touching your eyes, nose, and mouth when your hands are unwashed. People that are sick, we want to avoid contact with them. Sometimes we have to care for people, and if we do, just make sure you're using the universal precaution. And if anybody needs any type of assistance, make sure you reach out to me, because we can help with getting you some of the proper face masks, or at least giving you advice on universal precautions. If you're having to deal with someone at home that's contracted COVID-19 and you're having to care for a loved one, we know that can be challenging, and we're certainly here to give you advice and help you with any of the universal precautions. And if we have masks to help out, we'll certainly share that with you as well. Cover your cough and sneeze with a tissue and then throw it away, or make sure you cough into your elbow so you're not spreading germs. One thing we spoke about, that's 6 foot apart. If you're coughing and sneezing, you can throw that one out, because your cough and sneeze travels rapidly, and those droplets are full of virus. And I spoke earlier about viral load. Those would carry a much higher amount of viral load than someone that is just speaking like I am right now. So people should respect other people in their environment and make sure they cover their cough and sneeze. One of the early on ones, make sure that surfaces and objects that we come in contact with are clean. So we're going to clean and disinfect frequently. We set a policy here at the fire station that we're disinfecting our stations on a daily basis, and we're going through and really keeping everything clean. We're out running calls and we're coming back, and so we're trying to make sure that we don't become an outbreak area. We've had a couple here, but we know that when we put some of these universal precautions in place, that we're able to minimize that effect, and we've done very well. After the first onset of the Delta, we had 10 people out. Now we threw these universal precautions back in and make sure that our personnel are following them, and we're protecting ourselves. We haven't had a breakout in weeks. So those high touch surfaces that are tables, doorknobs, your desk, light switches, countertops, things like that, make sure that you're able to wash them down and disinfect them. Always monitor your health. You certainly know your health better than anyone else would. If you're starting to feel some symptoms come on, continue to monitor them. If you need a test or you need some advice from us, You're always welcome to call me. We can test people here at the fire station within our community. We feel fine doing that. So we're always opening that up to you all if you need any of that. Some of the NCH data today at NCH 17.4% positivity rate. We do know that their patient number fluctuates, but today they are at 472 between both NCH downtown here and NCH North on Immokalee Road. There's a typo there that should be of the 472 patients, 155 are COVID positive, and of those 155, 127 or 82% are unvaccinated. So I'm not telling you that if you're vaccinated, you can completely avoid this. There are breakthrough cases, and some breakthrough cases do get sick. All of these in the hospital today of the breakthrough cases are not in the ICU. So that's one thing I would like to point out, because the vaccine does, if you do have a breakthrough case, sometimes you'll be asymptomatic or you'll have mild symptoms. And if you end up going to the hospital, those mild symptoms are usually treated over a couple of days and you're sent home. So we're not seeing a lot of those vaccinated people having to be admitted into the ICU. It happens occasionally, but it's not very often. Of the 127 patients that are unvaccinated, 57 of them are in critical care. And NCH is at 146% critical care capacity. So there's 69 of 47 beds completely full. 34 of those patients are on ventilators. And currently today there's one pediatric patient. And I know I always like to point out that even though they're over full in their ICU beds, they have the capacity to expand their ICU. But when I talk to some of our partners over at NCH, they're always concerned about having enough nurses and medical staff to meet the needs of expanding bed count. So I'm going to go on and stop sharing right now and give you all a couple minutes to go ahead, and if you have any questions or want to discuss anything with me, I'm here for you.
First, I'd like to thank you, Chief. The ability of Gulf Shore Property Owners Association members to get vaccinated, the first vaccination and the second vaccination at the firehouse, was a very wonderful experience. It worked very well for those people who took advantage of it. Thank you so very, very much.
It was my pleasure. It was something that we said early on that we really fought hard to get Station 1 as a vaccination site. We really wanted to take care of our community, and we looked at all the other vaccine sites that went kind of haywire, and we avoided all those things and tried to make it a smooth process for our community. And I'm glad that it did go smooth for you and other members of our community.
I have a question. I don't know if you can hear me.
I can.
Okay. I live in Toronto, Canada, and we're a country, oh God, won't even go there. But anyways, what is going on as far as getting our booster shots? My husband and I are luckily both American and Canadian citizens, but what's happening with the booster shots?
So right now, Pfizer has been approved by the FDA for booster shots, and you'll start seeing, I think, the vulnerable people in our community or with comorbidities, or they're the first up, as well as persons over 60 population, so we can get that taken care of in a systematic approach. Johnson & Johnson right now is still in the early stages with FDA, and I think we'll probably have to be waiting a little while longer to see what goes on with Johnson & Johnson.
Yeah.
Oh.
Okay, now we got the slide back.
Everyone should go to mute.
I
Everyone
am
should
going to
go to
leave the
mute.
meeting. Thank you so much for having me today. I appreciate your time. And again, if you all need anything at all, don't hesitate to reach out to me.
Thank you, Chief.
Stay well.
Okay, hang on. Okay. So my meeting topic was going to also be the Naples Beach Hotel and the website. So real quickly, this is a shot of the website. Hopefully you can see it. And I encourage you to come to the website. If you want to contact us, you can contact us. You can also chat. We're posting new articles under news articles. So one item that I would like to bring to everybody's attention and strongly encourage you to act on is this relief from loud leaf blowers. So the city council approved a requirement that leaf blowers must be below 63 decibels. I think it's incumbent on all of us to inform our landscapers that they need to comply with the law. And the law basically says, if the leaf blower does not have posted on it clearly how loud it is, it's not allowed. So it's kind of interesting. So pay attention to that. There's also bubbled up recently, I got a couple emails, maybe some of you got emails about it too, about that plan they had a couple years ago about reducing the number of lanes on Route 41 down by Fifth Avenue. Personally, I'm not in favor of reducing the number of lanes. That seems to me like a prescription for moving traffic onto other less traffic roads. But whatever your opinion is, I encourage you to contact the city council and let them know. In terms of the Naples Beach Hotel update, most of you know Gregory Myers filed a lawsuit. There was information in the Naples Daily News about it. They've since stopped writing about it. I know he had another follow-up lawsuit at the end of August. I haven't heard much other than that it's continuing. And the issue for the Athens group is they're not going to close on the property and buy it from the Watkins family unless they know for sure that there are no lawsuits pending on their construction plans. And part and parcel of that is Michael Dell, who's investing and providing the funds for this construction. He's not going to give the Athens group the money as well, unless it's free and clear of lawsuits. So I suspect this lawsuit's going to continue a little bit longer. There'll be some going back and forth, but at some point, I gotta believe it's going to get settled, because I can't believe that that's going to stop up, that it's going to remain in limbo forever. There's too much money on the line for something like this to be on hold forever. So, but again, that's where we stand on that right now. We don't have any specific news other than it's on hold due to the lawsuits. Any questions, comments?
Yeah,
So,
I'm in touch.
and you're sharing your screen now.
Yeah.
The National Institute of Building Sciences, and this was sponsored by the Building Officials Association of Florida. And it also included the ICC, that's the International Code Council. Now that council is the council that develops and updates the International Building Code, which then Florida takes and changes it for Florida specific reasons to change portions of the code that meets Florida specific requirements, and then it's adopted as the Florida Building Codes. Now they met on August 17th, and they found that in an overview that currently 20% of our jurisdictions in Florida have a property maintenance code for existing buildings that have not adopted a minimum building code for maintenance of existing buildings. 22% do have a reference model housing or existing building abatement code standard that were developed in the late 1970s. And I believe that's our ordinance. There is 36% of the jurisdictions have implemented locally developed property and building maintenance regulations. 22% have adopted the more modern International Property Maintenance Code. And that is developed by the ICC. And less than 3% of our jurisdictions have implemented a periodic recertification or inspection safety program for existing buildings. They also performed a national survey, and they also looked at the adoptions of a statewide property maintenance standard for existing buildings. The result of this is that the Florida Building Commission is now working with the ICC to provide a current adoption of a new appendix in the International Property Maintenance Code that would be Florida specific for inspection purposes for existing buildings. And the 3 phases of periodic inspections would be intervals over the service life of a building being performed by the following. And that'd be maintenance inspection performed by the building code official, owner or owner's representative, periodic inspections performed by the building official or licensed design professional, and milestone special inspections performed by a special inspector who was qualified and a registered engineer in the system discipline being inspected. Details of each of the required inspections, including reference documents, are to be used for inspections. It also includes the roles and responsibilities of all parties, including the building code official, criteria for assessing and identifying the existing design, inspection of building construction materials and how environmental influences may affect their future performance, inspection records, including sample inspections report forms, and resource materials providing additional information and guidance. So what Florida had response is, they're going to have a Florida-specific appendix in their International Property Maintenance Code that will be Florida-specific based on our coastal and environmental requirements here in Florida. What the municipalities will then need to do is adopt this International Property Maintenance Code to then enforce the periodic inspections of buildings. It will not be mandatory, but it will be a guideline for municipalities to use as a resource and be adopted into their local ordinances. Currently, the Florida Building Commission is reviewing this appendix, and we should see this probably be adopted during the next legislative cycle. I can stop sharing here. Okay. So if there's any questions, I'm here to answer them. So in overview, what we're going to see is we're going to see the state providing an inspection process through the International Property Maintenance Code that municipalities will adopt if they so choose to, and we will enforce it.
So you're suggesting that the legislation will be, not legislation, but it'll be a guideline and we can, or Naples can or cannot adopt?
That's correct. It'll be up to the municipalities. It will not be a mandatory state code.
Okay, I for the purposes of all the people that are on the call, I shared with Craig the topics for the questionnaire, which we'll get to in a little bit. Craig, have you had a chance to look at it?
Yes, I did.
What do you think of the questions that we're asking? Do you have any thoughts on that, or do you want to, you think that we're wasting our time, or do you think it'll be productive?
No, I think it will be productive. Currently, what we're spending our time on is to try to develop a database of all our existing buildings. Up to now, we don't have that. So we've been working on, and I've shared that list with you.
Yes.
We're not certain of the accuracy of it, but it's the best that we have right now. So if your group does get responses to this survey, we can match it with our database to make sure it's up to date.
The survey had to do with the height of the buildings, the location of the buildings.
Craig, can you make me the host?
Okay, how do I do that?
Go to your name,
Okay.
find me, and make me the host. Joe Basoy.
Technology.
Okay. All right, you're the host.
Right.
So again, Doug, yes, I think it's very critical to have that information. And it would be very helpful that if and when Naples does pass an inspection system for existing buildings and a code ordinance, then we could make sure that we have the most up-to-date information.
Can you go back to the previous slide, Joe? Okay. This is the way we're thinking about this, Craig. We want to get responses from all of our members. Some of the responses will probably be sensitive, and I want everyone to know that the responses will be grouped into a report back to all of you, but we will not be naming the buildings. It will not be defining exactly what the age of the building is or anything about the height of the building, et cetera. So your responses will be confidential. Next slide, Joe. Joe? Joe, are you there?
Well, if that's so, Doug, then the board itself could match up your data with our data and let us know what changes may or may not need to be made.
Yeah, and when in that regard, Craig, what I'll do is I'll circulate the sheet that you provided us with the building information that you have, and ask them to review it and get back to us, and then I'll get back to you with the response.
That sounds good, Doug.
Okay. These are the categories of information that we're looking for: the height of your building, the year it was built, the prior structural assessment, and plans moving forward. What have you done in the past, and what are you thinking about in the future? The selection of an engineering firm. What are the owners' level of concern? What are the levels of concern for your individual owners within your condominium or cooperative? Did you do reserve studies? If you did, when were they performed and how were they planned? Are you reserves fully or partially funded? That's important. Are you fully funding or partially? A lot of us are partially funding our reserves. It's important to know that. I think we should know how we stand in relation to everybody else. Directors and officers insurance. Duncan loves this topic. D&O insurance coverage, is it in place or is it being considered? Other liability insurance coverages. Do you have any?
Are you going to that place that you told me about? Because I did pass that on.
Yeah. Yep. And I'm late, so I gotta go. Bye.
Is that Penny? Level of owners' concern and their recommendations. Have you heard from your owners? Do they have a high concern, especially as a result of what happened over in Surfside? And what are their recommendations? Next slide, Joe. Go.
That's the next slide.
Oh, okay, I'm sorry. Well, that was it for that presentation. Craig is saying we'll formulate something like this and we'll do it on SurveyMonkey and get it over to you hopefully within the next couple of weeks, so that you have a chance to come back to us well in advance of our next meeting. Joe, any comments in that regard?
No, I think we're set to go. So look for a link for the survey and to participate. And our goal is we want to come back on December 2nd with another call where we share the survey results as well as have another city council member talk on the call.
Yeah, I'm looking at the participants and I think we lost Penny Taylor.
I think
No.
she's still on.
Oh, you there, Penny?
I
Are you
am.
ready?
Okay, well, why don't we give you the screen? Or do you, oh, okay. There we go.
Okay,
There we
thanks,
go.
Doug. I'm gonna leave the meeting as I have another meeting to go to.
Thank you very much, Craig.
Okay, thank you.
All right, good afternoon.
Good afternoon.
So we're here to talk about the Army Corps of Engineers, and I think as we proceed here, briefly, if you watched the meeting, but even if you didn't, my concern with the plan, I often say this, this is like a woman that listens and a town that negotiates halfway to surrender. And for me, this is what's going on here. Why we didn't say thank you very much. We appreciate the hard work you've done, but this is really not suitable for us, is beyond belief, but they didn't. And so here we sit. There are 3 major areas that I'm concerned about with this plan. First of all, because, you know, entire neighborhoods are left out. So it pits neighborhoods against neighborhoods. It also puts the neighborhoods that are left out at a great disadvantage in terms of their cost of flood control and flood costs for insurance. And then the second one is the issue that even if this plan was fully implemented to the tune of today's money, and it's probably not going to be that, it's going to be more, $750 million of taxpayers' money, local taxpayers' money, it's still only 36% effective. And so that means, and they do talk about life, they do talk about loss of life. So think about this. So you have 100 people and there's a huge storm surge coming your way. You can just say, 30 out of the 100, 36 will be alive. The rest will just die. I mean, this is a plan we're considering. And then finally, and for me, it's a hugely important one, is the parking, and it's the right of ways. When you take federal money, there's a cost. Their largesse has a price. And that means that we cannot control our parking in our cities or in our county. We cannot control right of way that they need to use in order to access the beach. So there's a lot of issues that have not been addressed yet. I would have preferred, we accepted the plan. That's what we did. We accepted the plan in April. We did not say we're going to go forward. The only way that comes apparently is a couple of years, and it has to be funded accordingly. So when we put money down to say that we are going to accept this plan, and by the way, we're going to do this project and we have funded it this much, that's when we move forward. We're not there by any means, but for me, it's important to understand what we're facing and just start independent of the core plan. Use their data, of course, use their data. They've worked very hard, but start implementing what I thought we were doing 4 years ago. So that's where I'm sitting with things, and I'm definitely open for questions. No questions.
No, I'll start off with a question.
Okay.
It seems like some of the environmental groups were opposed to the plan the way it was originally written. Are they opposed to the plan the way it was written or entirety?
It's hard to say. You've heard about Miami, and I did have an opportunity to speak to his name is Murley, and he's working directly with the mayor of the county commission of Dade County. That's how they work. That's her title. It's a strong mayor. She's in the deciding position for whether that plan goes forward or not. And you heard how they rejected it. And the issue would be for them, okay, we're going to bring in more environmental features. But the Corps is on record in an interview, and if you haven't seen it, I can send it to you, saying by a WRLN interviewed them, well, now have you ever done, well, we haven't ever done that kind of a localized plan, feasibility plan, but it can be done, and we're very open to it. But if it doesn't make sense to our cost benefit analysis, Miami's just going to have to pay for it. Here we are. So my concern is that we're moving in a pathway that I think we all have to watch very, very carefully and be very cognizant and make our views known. at the same time, we need to start planning for that major hopper dredge, which I've heard about for as long as I've been here. And it's going on 8 years next year in the county, which is the, bringing it in from our sand source in the Gulf of Mexico, making our beaches wider, start planning our dunes, bring in the scientists from Savarese and Sheng from the University of Florida, the FGCU with their Coon program, and really start looking at making our beaches a different configuration, which hopefully will, protect us against storm surge. And mind you, and this is true of with this plan, it's even come forward, and it's true what happened in Miami. These Army Corps of Engineers, their issue is flood control. And that's what they're concerned about, and that storm surge, right? That's what they're worried about. They're not taking into any consideration about water that is other water, like sunny day flooding, tidal influences on a regular basis. Those kind of things have not been addressed in this plan. And I think Miami understands it because of what's happening in the beach, where you have sunny day flooding probably once or twice, maybe every month. So it's an issue that we still have to address. People say, well, keep them in your back pocket. It's always good to use it. The minute we use the largesse of the federal government, they've got us. It's kind of Shylock's pound of flesh. And I'm very concerned about it.
Gary McAlpin is very much in favor of the plan. Why is he so in favor of it?
Well, he's not here anymore. I said to myself that this is kind of Gary's goodbye gift to the community. I think he's a planner, and planners like to plan, and it becomes almost an engineering technical aspect that maybe that's why he's in favor of it. I mean, I think there's pride of authorship here. He did, quote unquote, bring the Army Corps back to Collier County when the commission in the 90s said, no, thank you. We don't want your help. We will go on it alone. For the very reason, I'm told by someone, Colonel Schmidt, who sits on our planning commission, who talked to Gary, that Gary knew this was going to be the cost because the commission at the time in the 90s turned the Corps down because of these very factors, because of the parking, because of having to give up too much. Understandably so, because when you're using federal dollars, you have to accommodate everybody. And that's not what Naples has never been about. That's what your city council bravely decided to do in June, to limit the parking on the beachheads to people in the county with stickers. I mean, that's courageous stuff. They've increased the parking for the people in the county doing that. We won't have that control in the future. I think the cost is too high. Plus, it's only 36% effective.
How do I, Penny, I'm on only audio. How do I participate in this discussion with you?
I can hear you, so that's fine.
Okay, my name is Nat Norton. You and I have actually met a long time ago. I live on a Gulfront property and am very familiar with storm surge, with dunes, with dealing with storm surge that we had as from a hurricane. I forgot in 2019, the big one.
Irma.
Thank you. I'm covering a lot quickly for everybody here, but I want you to know that I could not agree with you more strongly on virtually every point you made, whether it's the there are no free lunches, the extraordinary cost of this, I couldn't agree with you more, not only that they'll be looking for a pound of flesh, and the irony of this is, as I think you've also been suggesting, is that this will in effect ruin not only the character of Naples, but quite frankly, and this is certainly because of my own experience in dealing with DEP and the coastal control line and all of this stuff, is it will ruin the still, as most, I'm assuming most people here who are merchants in Naples and obviously realtors, it will ruin the very beaches and beachfronts that are such a draw here. So this thing doesn't cut it on any standpoint. And I don't know how much time you have, but I'd like you, if I missed it, to say when you said, well, there'll be, I believe you said there'll be plenty of time to express public concern over this. It's by no means a done deal.
Correct.
Okay.
So I'm told by staff, and right now the head of this area of our government is Deputy County Manager Amy Patterson, who has been interfacing directly with the Army Corps, with staff. Andy Miller has taken Gary McAlvin's place, so that's the hierarchy. So I'm told by Ms. Patterson that it's 2023 that before the Corps will present that final plan, and we have to thumbs up or thumbs down. We have to decide whether we're going to cooperate and be part of it or not. But since the Corps, because the appreciation of property values in Collier County has been so great since the inception of the plan, which the beginning of it, which was 3 years ago, as we all know, property values have gone up. Their whole cost benefit analysis is off. And they have to go, they're actually saying, whoa, we were going to present this to I think the chief in October, but we can't do that now because suddenly what we're saying is going to make sense, isn't making sense because the property has appreciated so much. So we're kind of in that limbo time of waiting for them to come back. So that's where we are. I think
Penny, between now and then, is there a chance to go back to where, from what I gather, the majority of those of you on city council were, and that is to simply, whatever it's called, choose not to participate?
I don't see why not. I was very surprised. I always was told that the plan is a complete plan, therefore no one can opt out. Now I heard Deputy County Amy Patterson at our meeting, which we appeared in virtually at the city council, say, yes, the city can opt out. I would encourage you to do that. You know, I think it would take away a lot of angst, but at the same time, it doesn't mean that we're going to suddenly ignore the major entity that has the greatest expense of beach in the Collier County. I mean, frankly, you have to ignore Marco, right? It's not even included. And so now the city has opted out. So what does that leave? Pelican Bay is out of it. Right. So now we just got the north end. But I would, if I was in the city, run that narrative to the end. Find out if indeed, number one, you can opt out, and what does it take to opt out, and what does this mean? I would pursue that.
Okay.
Because what do they have without in this plan if the city of Naples isn't in it?
Yeah, you're good point.
And I don't know that much about the plan on the north end. I know what's happening south of Doctors Pass and Wiggins. I don't know what happens in front of the Ritz-Carlton and Bay Colony. I mean, that's Bay Colony's Pelican Bay. I think the Ritz is Pelican Bay. So the only thing they've got is the condos and that north end going up to Barefoot Beach.
Yeah, well, where I live is actually just north of the maybe someday new Beach Club Hotel.
Okay.
So, and between there and Doctor's Pass. I mean, ironically, most of that a beachfront in that area, and certainly right in front of the Bahama Club, the beach is so pinched, and that's a combination of two things. The beach restoration over the years that has built sand higher and higher, and the fact that a number of us our buildings, particularly the beachfront portions of our condominiums or co-ops, are at sea level, almost at sea level right now.
Yes.
So there's not much that can happen there, even if they wanted to, unless the Army Corps of Engineer has the ability to hold back the tide with a wave of a scepter, and I don't think that they do.
They actually started the dialogue on the East Coast of condemning buildings, and they talked about it here, and then they backed away from it.
Yeah,
yeah. So, and then you know what condemn means. We don't mean, this is nothing, we would condemn them and everybody has to move. They backed away from that on the East Coast, and they backed away from it here. But I in my quieter moments, I wonder if the Army Corps is laughing at us because we're willing to spend $750 million with a 36% success rate.
But we live in a political world where it's very popular to spend billions of dollars and worry about whether or not it's money well spent later on.
Well, that's true.
We don't have to get into that.
Okay, Dave, thank you very much. Is there any other comments or any other questions for Penny before she has to move on? Penny, I want to thank you for all you do for the city of Naples and for the county of Collier.
Thank you
You
very
are
much.
terrific.
Thank you.
Thank you.
Bye-bye all.
Bye, Penny.
If I can help you, let me know. Thank you.
You bet we will.
Thank you for your time.
You're welcome. Bye-bye.
Okay, I see a slide up there about fiber optics. And we have two providers on the line here to talk to us about fiber optics on the boulevard. One is from Blue Stream. I'm sorry, Blue Stream. And the other one is from Summit Broadband. Who would like to go first? Unmute your.
This is Mark with Summit Broadband. I'd be happy to let Blue Stream go first if they like, or I can. It makes no difference.
Mark, why don't you
say
start?
Mark, since you're unmuted and you're good to go.
Okay. Thanks, everybody, for having us on. I just want to spend a couple of minutes just to let you know that we are an alternative to your current provider, Comcast. We've been in this market for quite some time, started as Marco Island Cable a long time ago, back in the 80s, 70s. Purchased Marco Island Cable, purchased a fiber placement company, and then aligned ourselves with Orlando Telephone Company. We became Summit Broadband. Currently, we have about 40,000 residential condominium and single-family home communities down here in Southwest Florida, meaning from Marco up to Fort Myers, that we provide services for both TV and internet. Where you're located out there on the beach, your only real provider today, I believe, is Comcast. They have older infrastructure that's been in the ground since the buildings were originally built. And so what we do is offer you an alternative when your existing agreements with Comcast come up. We offer you a fiber-based solution where we'll bring fiber right down Mooring Line Drive, and then run it right along the beach down to where the new beach club is going to be, and provide your communities individually with a television option, an internet option, a double play where you select both TV and internet, or probably as the future goes forward, TV is going to be less needed, but more internet. So we can offer you an internet only option. And then your residents can buy TV from us, you can buy it from Comcast, or as some of you may already be doing, you can buy that basically over the internet, download it directly into your TV and purchase a Netflix or a YouTube or well, there's 40 or 50 different options out there. Now, our issue is that to run our fiber optic lines from down Mooring Line Drive and over your little bridge there to meet all of your communities, there is a capital cost involved for Summit Broadband. So one individual agreement for a 30-unit condominium, the math just won't work out on our end. But if there are 2 or 3 of you initially that like to make the switch to Summit Broadband, then we're talking about 90 to 100 units. That covers the cost of our internet, and actually had presented a little bit last year, but it was during the COVID season, and not too many people were interested there. But what we'd like to do in the end, if we get enough participation, is give everybody a one price fits all type solution. But if we just have one community that decides they'd like to do that this fall, then it's first one over the bridge pays, so to speak. So that would be quite expensive and probably wouldn't make sense for yourself. So just wanted to let you know that I am here locally. I'll be available to meet with your individual associations to discuss what our options and pricing would be. But in essence, we can provide you with a TV and an internet bulk solution for probably somewhere around $70 a month, plus or minus, 150 channels of TV, wireless internet in your homes, up to 1 gig by 1 gig, which is 1,000 megs at a competitive rate. I happen to live in a community today that doesn't have any bulk services, and I pay to Comcast about $175 a month individually. Anytime you bulk a service, of course, you're going to get a reduced out-of-pocket expense for the individual homeowner. Say one thing, that in the last year, we were purchased by Grain Capital Investment, and their investment in our company has allowed us to go to the next generation of both video and internet. In years past, when we built fiber out, we were providing you with 1 gigabyte total speed to your individual unit. We're going to the next generation. It's called XPON. That means basically 10 gigabytes to each home. We're not too far away from a point where your refrigerator will talk to you and will have a computer chip inside of it, and it'll need to be, hooked up to the internet. You already have that likely now with your thermostats. And so all devices eventually are going to need to have that. With COVID now, we're doing more talking to our doctors on video. We have this video conference today. All of that takes up bandwidth. And so a fiber-based solution to your unit makes a lot of sense. And it basically future-proofs your community for the next 20 to 30 years.
Okay, Mark, thank you very much. I will share your contact information with the board and with the owners and members of the association, so that they can contact you and you can speak directly with them about their individual issues as their contracts come up for expiration and replacement. Similarly, we're supposed to have Blue Stream on here. Is anybody from Blue Stream on the call?
Jennifer?
Hi, good afternoon. Thanks for inviting us. I am Jen Hutchinson. I'm the Director of Community Management here at Blue Stream Fiber. And so we are really excited to be offered the opportunity to come in and talk to you about the products and services and why we are the choice provider of Florida here for fiber optics. So we've been in business for over 40 years. We are the provider of choice on the other side. We are the hometown brand that you would know, absolutely love. We service Cleveland Clinic and a couple of other hospitals over that way. And what we do for associations, and we bring them that same hospital grade redundancy right into the community to make sure that there's absolutely no foul points and no cut within their services. What we learned from COVID-19 and the last 18 months is internet is no longer a luxury, right? It's a necessity. And that's why we're all here today having a conversation. And it doesn't matter our geographical locations, we're able to conduct business and keep things moving as we would have expected prior to COVID.
How'd you make the smoke detector?
I don't know, Marcia.
Oh, sorry.
It's okay. So what we do is we bring true fiber optics into the home or unit. So we are a true fiber provider. We do not create a hybrid or any type of system, which would be called either an HFC or RFOG. And so what that means, and it's really critical to understand, is sometimes you can bring fiber optics into a building, but then it could be converted in the unit or into the DMARC where the meters and all that equipment and information sits, and then it's converted back to radio frequency. So what I would do, if I were any of you, I would take a look at either your unit or the unit that you're overseeing and see how it is constructed. Is it a coax that's coming in because if they were giving you fiber, maybe it's not really truly fiber. We want to have a conversation about that. That could be creating any type of issues or latency or bottlenecking that might be happening, creating white lines on televisions while you're trying to watch that. Or it could be that red circle that's happening when you're watching Netflix or trying to watch Netflix. And we could really start to troubleshoot some of that. But then talking back about the fiber optics, the reason why we are a choice provider is because we are white glove service for all of our customers. And so we would invite you to take us up on a meeting, just like Mark said, and sit down with us, have a conversation. We'd like to be a partner with you. And to be a partner, we really truly have to understand your association piece by piece and find out what the mission statement is. Where are you going in the next 10 years? And so if you would send us an email, Doug's got a list of our emails so that he can put us in contact really, really easy and make an appointment with us, whether it's you as a property manager or you as a board member. We'd love to just start that conversation and see how we might be able to help protect your home values and bring more value to the Boulevard. Jenny, our VP of Operations and Sales here for the South region is on. I'm going to pass the baton over to her. So she can introduce herself and say a little bit more about our company. Jenny?
Hey guys. Hey, hi everybody. My name's Jenny Sanchez. I'm the Vice President of Blue Stream Fiber. So we don't normally do presentations with our competitor in the room. Yeah, so this will be quite different. So we normally ask to go either before them or after them so that we can respect each other's time and respect the board's time. So really, this is a quite different conversation than we would have with you privately. Blue Stream's been in business since 1978. We're a cable television statewide franchise operator with the state of Florida. We currently have customers all throughout Florida, including in your very close to your neighborhood, including our network is very close to your neighborhood. So we'd love to sit down and talk to you more about Blue Stream, but we have all the channels that you're used to watching: CNN, Fox, HGTV, ESPN. We have all the channels, all the technology, and we deliver it over a fiber network. So let us know, let Jen know, she's your point of contact, when a good time is so we can come in and sit down with each board and each association and talk more about Blue Stream Fiber. That's it. Thank you.
No, thank you both. We will share your information with the community as a whole, and they can contact you directly. Just a comment, there are probably other providers out there that might have liked to have the same opportunity, but these two individuals, both Summit and Blue Stream, have been more aggressive in our community and are interested in partnering with you. So thank you both very much. We can leave the meeting now and we'll move on. Thank you.
Thank you.
Okay, what do we have left on the agenda, Joe? Collaborative subjects. Collaborative subjects, which is what I'm all about. I always want to share and hear what you have to say. So why don't you take it, Joe?
So I was just going to say, we don't really have a lot, but we do have the website. open for you. You know, we're hoping that we can get you to collaborate. You know, what's the best restaurant in town? You know, who are you using for insurance? How much are you paying for dues? So lots of things. We do want to conduct that survey that I mentioned before with regard to understanding the building information. Again, as Doug said earlier, we're going to keep your individual responses confidential, but in aggregate, maybe there's some useful information that we can share with Craig and understand better our situation. So we don't have a similar collapse like they had in Miami with the Surfside building that was in Miami, not the one in Naples. So look to, please mark your calendar for December 2nd. That's the day we're gonna have our next meeting. I noticed that Teresa Heitman, our mayor from the city of Naples, is online today. I don't know whether she's still online, but we'll look to circle back and potentially have her or another city council member on. I think Penny was very interesting. You know, when I first read that she was the one lone dissenter from the Army Corps of Engineer, I thought, wow, that's interesting. But she explained it pretty well. And I think that's one of the benefits of being on these calls. I would encourage you, we don't just limit this to, you know, board members. So if you have other neighbors that want to join these calls, please have them join. And the same thing with the website. We've got links and information on there, but if you think we're missing information, we've even got information on mosquito control on there. So if you've got bad mosquitoes, this year they seem to be pretty good, but you know, there's information on there that can help you with the town and, you know, with things that you might want to benchmark. So let's open it up. Does anybody have any comments? I muted some of you because there was some crosstalk, but if you need me to unmute you, just chat it in to me and I'll try to unmute you. And, but I think most of you are still open in terms of not being muted. So feel free to chat. Does anybody have anything they want to share? I know we've been on the call for more than an hour, so we're running a little bit long, but I'll pause the sharing so you get front and center.
I have a question. Can you hear me?
Sure,
We can hear you, and we can see you.
Oh, okay, great.
I think the mayor was trying to speak.
Oh, okay. Let her go first.
Oh, no, I just wanted to say hi and thank you for inviting me. We did have a joint Naples Airport Authority meeting that was canceled, so I was able to jump on the conference in the Zoom, and I appreciate the invite. And I think you had some very good topics of discussion, and I'd be happy at any point to come and be a part of that agenda and whatever you'd like to speak about.
Thank you very much.
I have a couple of questions. They're unrelated. One is that was brought up very briefly is the Naples Beach Hotel. One of the owners in my building, which is Colonial Club, and I mentioned it's a very small building. I guess there's some guy that is still having some lawsuits. Now, I do understand that Athens Group has agreed to keep the golf course as an 18-hole golf course. So that group that was against the 10 9-hole golf course. Teresa, you're saying no?
No, they agreed to nothing.
Oh my gosh, really? Because the guy that I know has been very involved, and Mary's group apparently dropped their, signs and whatever because they were told that the Athens Group had agreed to keep it an 18-hole course. That's very interesting.
We've paid over $500,000 with the firm on protecting that easement, and they've come to absolutely not one agreement.
Wow. Well, I'll let the people that I know about that. And the other thing I wanted to bring up, there was a survey done about security. And again, we're a very small building. We've had people, the nerve of people, they actually bring trucks to our beachfront entrance from Gulf Shore. All these people come out, blah, blah, blah. We spent $26,000 on security cameras. I am the president now, but I was a board member at the time that I thought that's money wasted. Because unless somebody 24/7 is watching these security screens. What the heck are you going to do? So what was some of the other feedback from some of the other condominiums about moving forward with security cameras?
We haven't surveyed it ever, so I can't give you specific survey feedback from GSPOA, but
The question was raised by Indies West about, I guess it was about maybe 4 or 5 weeks ago. And I circulated the question and I got some answers back from the membership as a whole. And I think that the bottom line of the thing is that security cameras are a deterrent. If you have a sign that says you have a security camera up, it acts as a deterrent. But whether you actually are able to interface with the perpetrator of the problem is questionable at best. And I'm not sure what the police department thinks about this, but we may want to check with them. And if I can, I'll get back to you on that.
Oh, I've had the police over. As soon as I became president, I went next door to Whitehall, who is our neighbor to the south of us. And Dave suggested I call the police. And they told me there's a new rule. If you actually see someone's genitals hanging out, because we have people coming from the beach peeing in our corner, and somebody saw a woman totally get naked and change her outfit from a bathing suit to her street clothes. But the police said, if you have pictures of them, to call the police, and they actually now can be charged and be put in jail. Who the heck is going to have the time to do that? By the time you take pictures and call the cops, it's ridiculous. It's a real problem. Our security cameras obviously have not done the trick. We have signs out. We've had to plant, what do they call them? Grape seed or something. I'm not sure what it was. But anyways, it's a real problem. And I just can't believe the nerve of these people coming either off of Gulf Shore or right from the beach, using our property in such a disgusting manner.
Okay.
May I make a comment?
Please.
Hello, thank you. I'm up at the chateau, and I have to say that we had the police out also, and they came and really presented us with a sort of a security report, which was very nice, because we were questioning whether to put up cameras or not. And they are, I think, considered a deterrent, but not a great deterrent by any means. And the police have been absolutely wonderful with our condominium association. If we find we have trespassers on the beach or at our walk through the condo association onto the beach, if we can identify them, the police will come out and walk the beach and find them and talk to them. And I think the police said, if enough people do this, and if we can find enough people that are trespassing and talk to them, that word will sort of start circulating that they're going to have trouble with the police. And so the police have been very, very kind to us and very helpful with our trespassing. It's we know it's going to be a problem, but our condo association owners that are there will watch people, and if they go to the beach, call the police and say, yep, I'll tell you right where they're at. They're right down there on the beach, and you can go talk to them, and the police will. So we were so pleasantly surprised with the police department. But we have considered cameras and decided not to do it because I heard that they create a lot of problems in the respect that one owner pulls his car in and hits another owner and it's caught on camera. And so we decided not to do it. So that's just the comment that I thought you might be interested in.
Any other comments?
I'll add a comment. This is Joe. At the Surfside Club, we had a continual problem with people cutting through the pool to get to the beach, to get to the Gulf. And we fobbed the pool. We had a plastic fob that we gave to all the owners, 4 of them, initially 2, and they could buy more. And that was incredible. I can't tell you the number of cars that I saw come into our parking lot, because the parking lot is wide open, see that the pool was locked. They couldn't get in with a mag lock, and turn around, you know, for sunsets. People still were coming off the beach. Now the 2 sides of the building have been fobbed, so you can't get in from the Gulf and walk behind the condos. And the front is now being fobbed too. So, you know, again, we had a couple people we caught climbing over the fence of the pool, but for the most part, it stopped, I would say 95 to 98% of the problems we had. You hate to do it, you hate to spend the money, but it worked well for us. We couldn't secure the parking lot because there were issues. We looked at zoning, and we couldn't block access from Gulf Shore Boulevard into our parking lot due to concern about backups and stuff. So the parking lot's still open, but you know, in terms of what you could do once you get there, you can't get to the Gulf, and that's 90% of the reason why.
You know what? That's interesting, Joe, because we had looked at also using our fobs, and that we have 2 entrances to our pool. And the fire department told us we weren't allowed to do that because, God forbid, somebody's in the pool drowning, having a heart attack. And if the fire department can't get in, you know, we're screwed. So we were told we could not use fobs. So that's very interesting. I'm just a few doors up from you. If you're at Surfside, I'm at Colonial Club, because that is something I have suggested. And apparently the fire department said, no, you're not allowed to do that.
And now behind the buildings, it's fobbed. My understanding when we looked at securing the parking lot was that the fire department has a way to get into almost every place that's locked with a universal code, but the fobs don't have a code. I don't know, it never came up when we were looking at the zoning issues. And that's why we defaulted to the fobbing the pool instead of that. So I would encourage you to look at the fob situation. It's money well spent. Like I said, it prevents people from cutting through, and word gets out quickly. They realize they can't party at your pool anymore.
Okay, well, I'm glad to hear that, because I'm going to bring that up with our board that, you know what, let's go ahead and fob the 2 pool entrances.
Yeah. Now we had to also do something on the beach because people were coming in off the beach too, you know, and there is an emergency button to exit, but you can't access that emergency button from outside, you know, the pool.
Yeah, well, if you're familiar with our building, we've had to narrow our walkway. That's another story. But we've got signs out there that's where the stupid security cameras are that obviously made, it was no deterrent.
We tried that too.
Yeah, it was ridiculous. And we're actually, one of the owners checked out putting an electric gate from our beach access at the cost of $26,000. I don't know, you know. I'm just new as the president.
Okay,
so.
I think that we've covered this.
Yeah.
I think we spent a lot of time on cameras and things like that. We will continue to look at opportunities to secure your property. If we find any good results, we'll talk to the whole community about it. Okay, that's all I have. I would look for a motion to adjourn.
So moved.
Is there a second?
I second it.
There you go. Okay. All in favor?
Aye.
Aye. Thank you very much, Teresa, for coming. Really appreciate it. And
Bye.
everybody, thank you for joining us.
Great.
Thanks, Doug. Thank you all.
Bye.
Thank you.